welcome back to Medical Coding with Blue. Today's episode is all about ICD-11. Should we be preparing for this in 2024? If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so you all know that these shows are inspired by your comments, so I'm going to read the comment that inspired today's show, and then we're going to get into it. So, here we go. So the viewer says, "Hi Blue, should I be concerned about ICD-11? I would like to get my CPT this coming year," and I actually think they mean CPC, not CPT, because CPT is a code set and you can't get that. But you can get a CPC, right? But I heard that ICD-11 would eliminate ICD-10, and I don't want to waste money in a year time to find out that I won't be able to work with it for several years. What do you think? So here's the thing, guys. First of all, let's address a couple of things before we get into the article and things like that. If you hear something, you as a future coder, new coder, coding student, person thinking about getting into coding, if you hear something, it doesn't matter how experienced the person is or what they do or what their profession is, you need to follow up on your own by doing a simple Google search. Now, this article that I'm going to read to you guys today, I'll leave it in the description box below. It talks about the ICD-11 thing that's, on the horizon. But the thing is, guys, you all need to start doing your research. I mean, it's very simple with Google. Google makes it so easy. There's no need to go to the library before, where you had to look up all these books, which to me is a fantastic time. But for a lot of people, they're like, "Oh, I don't like books." I don't know how you want to be in this field and you don't like books, but whatever, But Google makes it very easy to just Google your questions. These are easily answered. And all of these things about these worries, about being concerned about ICD-11, you can easily put that to bed by Googling, okay? So this is an article that I found, and it gives a wonderful timeline about when the code set started. So I will get into the answer here in a minute, but I wanted to walk you guys through this. So the code sets started in 1900. That was the year that they were voted on, the year of conference when it was adopted. So the thing about it is, because this is a universal code set, meaning that all the states in the United States plus their territories, everybody uses the same code set. This is a code set that is looked at and everybody uses the same thing or a derivative of, because you have the other countries that have theirs, but it's all the same, okay? Every single diagnosis is there and all these kinds of things. But they call them different things, okay? I believe in Canada they call them, they have a CA at the end of theirs, because it's Canada. So, but the thing is, guys, when they have these types of code sets, you have a lot of people who are representing a lot of people's interests, okay? That's why they have 4 cooperating parties that make up the code set and manage the code set and things like that. So, and then of course you have the World Health Organization who oversees everything, okay? So you have to really think about, okay, there's so many players to this thing. It's not like how we have individual states and how they have their own laws, right? Some states have their own laws. Every state has its own laws, right? Well, when it comes to health information, this is a universal product, meaning that we all have to have the same. That's why they have to vote on it, and then they have to implement it. So when they vote on it, everybody says, yes, we all agree, this is good, this works for us, or whatever, and then it gets implemented. That's how these things are decided, okay? So that's what you have to know first. And this is just the diagnosis and all that side, okay? So that's what I want you guys to know. So for ICD-10, right? Well, not ICD-10, excuse me. For ICD, the International Classification of Disease, the very first edition came out, it was voted on in 1900. Then it was implemented in the United States from 1900 to 1909. And when they say year in the United States, mortality means that were using this to report statistics for people who had passed away. Why did they pass away? What did they pass away of? So they needed to have that classification of information so that way that they can report it, okay? So they can start to make this more organized, right? Because they wanted to get organized, and that's what this was. So when they had the second edition, they voted on it in 1909, from 1910 to 1920. And then the third edition, or the third revision, rather, not edition, revision, third revision was in 1920, implemented in the US from 1921 to 1929. The fourth was voted on in 1929 and implemented from 1930 to 1938. The fourth edition from 1938, it was voted on, and then it was implemented in 1939 to 1948. The sixth was, it was voted on in 1948, implemented 1949 to 1957. The seventh edition was voted on 1955 and then implemented in the United States from 1958 to 1967. The eighth edition was voted on in 1965 and it was implemented in the US in 1968 to 1978. So the year that it began being used to report not just statistics for people who had passed away, but actually for now starting that we had to start reporting codes for insurances and things like that. It started being used in everyday life, right? From 1968 to 1978, okay? Then the ninth edition was voted in conference. The year it was adopted, the ninth edition code set, the ninth revision code set was adopted, in 1975. The year in use that they were using it to report statistics for people who had passed away was from 1979 to 1998. I want y'all to pay attention to that. 1979, the ninth revision was being used to report statistics for people who had passed away from 1979 to 1998. But it was implemented for use for us, for everybody, everyday use for reporting for encounters also in 1979. So 1979 was when ICD-9 was implemented and started being used in the United States for encounters for like us that we saw, okay? Now, when I got into the game and I got certified in 2008, we were still using the ICD-9 code set, okay? Now, remember I said we have to vote on this. There's a vote. It has to actually go through Congress and it has to be approved because all these things need to be approved through the proper channels. Now, because of this, I don't know if some of y'all remember, but they had to vote on it to be implemented to ICD-10. And they had tried to start voting on it sooner than when I got into the game in 2008, but it kept getting rejected. Why? Because these are two separate code sets. Now remember, this is the golden age of when the electronic health record started to come into play. So you have this whole electronic health record that's coming in, right, in the early 2000s, right? And we started to have to protect health information. We started to have laws about it, right? High tech came into play around in the early 2000s too. I get very excited, guys. So in the early 2000s, it was when high tech came into play. Of course, we all know about HIPAA, right? And when it was implemented and all that to protect health information. But because the electronic medical record came on the scene, they had to have laws to protect it because you can't just have people willy-nilly out here with all of the health information that is now computerized and not just by paper, okay? So there was a lot of moving parts. And again, a lot of people were rejecting it because they were saying, no, it's going to cost us too much money to go into ICD-10. No, we need to stay in ICD-9 because it's gonna, we're not gonna be able to process the claims. That's what the insurance was saying. Oh, well, the doctors were saying we're gonna lose money because we're not gonna get our claims processed. We're gonna have to get people from overseas to help us because they already understand how to use ICD-10 and they're gonna be able to do all these things that these new coders are not gonna be able to do. Meanwhile, we're hearing that ICD-10 is going to be implemented somewhere down the way, and then all of a sudden they voted on it and they said, okay, you guys are going to go into ICD-10 for regular reporting for all of us, not just for statistical reporting, but it's going to be reported for like encounters, and we can use this data to be able to share this data, right? And because of this, that was going to be in October 1, 2015. So remember what I said, ICD-9 was implemented in 1979. That was when they started using it to report encounters. 1979 all the way till October of 2015. Well, September of 2015. 36 years we were in ICD-9. 36 years it took for them to change into the new code set. The new code set, ICD-10, and get this, guys. So ICD-10, the year that it was voted on in conference, was 1989. I was a youngster, okay? 1989, it was voted on. They started reporting ICD-10 for people who had passed away, those statistics for people who passed away in 1999. They started reporting it, right? And they're currently reporting it still because we're all in ICD-10 right now, okay? Need to make sure I say the right ones. Okay, so look at that. 36 years it took them to get us out of ICD-9. Now we're in ICD-10, and we've been in ICD-10 since 2015, okay? And we're still, that was when it started being used in the United States in October 1, 2015. It's still in use to report for statistics for people who had passed away, and they began that in 1999. Think about that, guys. We could have been in ICD-10 since 1999, but we didn't because, again, we started to have all of these new laws coming into play because the electronic medical record burst onto the scene. And they were like, okay, now we have this electronic medical record. Now, the way that these software designers design these electronic medical records or electronic health records, you have to set the codes in there right. And they have to write this code in order for it to know, like, how many characters can this expand to. Then all of the forms for the insurance have to be updated. All of these things have to happen, and it's a lot of money to change from one code set to another code set. Then you have doctors that are very set in their ways. That was what was happening. That was what was delaying us a lot of these times because they were saying, no, no, no. We're going to fall behind. We're going to lose money. We're not going to be able to provide care because we're not going to be able to get the funds in because people are not going to be able to learn this fast enough. They thought that us coders in the United States were not going to be able to learn ICD-10 as quickly as we did. But we did. My facility, we actually started having a program. We got our own trainers and everything. And we had that going for a whole year prior to implementing in 2015. Okay, so we were already starting the training from a year back, and there was people who had been training from a couple of years before then. I think some people were since like 2012 that they had been training themselves and they had been getting themselves proficient so that they can go and train other people. And so there was a lot of things that were happening around that time. This is something I haven't never talked about really on the show, but it's very interesting, the history behind us implementing these codes and things like that. But here's the thing, guys. Hopefully that answers your question now. It took us 36 years to get out of ICD-9 reporting that for encounters. What do you think now for ICD-11? We are nowhere near implementation of ICD-11. Nowhere near it. It's going to be further on down the road. There's years that go by, okay? Years that go by in between. We're, 8 years into 2015, 2020? Yeah. We're 8 years in to ICD-10. So again, we are nowhere near ICD-11. The thing that irritates me that I see is people start talking about it. Yeah, you can talk about it, and it's implemented. ICD-11 is actually implemented in other countries, right? Here's the other issue here too. We cannot share diagnosis data with the rest of the world because we are in ICD-10, where the rest of the world is in ICD-11. They're already reporting in ICD-11, and there's a lot of countries that are all implemented in that already. We are the only ones who are behind because we're very concerned with laws passing, and now we have to upgrade, and we have to do all these things. It takes a lot of money to upgrade and do all these things. You got to get the training. You have to get, of course, the systems to talk right, and then you have other systems that got to talk to each other. Then you have to be able to rewrite a lot of that stuff, and then a lot of that stuff gets phased out, and you got to bring new stuff in. So that's why I'm telling you guys, if you're worried about ICD-11 right now, don't. You're making yourself worry for nothing. Literally for nothing. Because, again, we are light years down the road from it. I mean, maybe not light years, but we are quite a ways away from implementation of ICD-11. The fact that they're talking about it right now is because, do they have anything else to talk about? I think there's quite a few other things that we could be talking about, but that's like a hot button thing that people want to get excited about. And to me, it's nothing to get excited about when it's so far down the road. And if we've already proved, us veterans that have been around since ICD-9, if we have proved that yes, we can go from ICD-9, which was very small code set compared to the code set that we have now, and we were able to learn this flawlessly and be able to transition on well, I think that we'll be just fine with ICD-11. So I'm not going to for me personally, I'm not going to worry about something that I can't control right now, that it's not anywhere near implementation right now, that is no concern, no bearing on my career right now. It has zero bearing on my career right now. Zero. So that's the thing that you have to learn about, guys. There's a lot of things that change with coding over the years. Look at the encoder, okay? Everybody thought, oh, the encoder's going to take over, the encoder's going to take over. It didn't. It's a tool. It's the same thing like AI. It is a tool. AI is a tool that can be used to help, these doctors whenever they're going through and they're looking at these things. They have the thing to help them in the electronic medical record when they're putting in a diagnosis, and they're putting in all the symptoms, and it kind of gives them a thought of what other things that they could use to treat this condition or whatever, or just giving them just different ideas. And that's fine because the doctor is telling that AI what to do. Okay. It's not going to take our place, because the one thing that we have that AI does not have is critical thinking. And that's the thing. The other thing too, that a lot of people don't really think about is the fact that we need to be able to critically think. If you're worried about something that is not even anywhere relevant to us right now, which is ICD-11, if you're worried about that, you're wasting time, okay? We have to learn to critically think when we're looking at this documentation. We have to learn to really understand the body, really understand the disease process, because that's what's going to help us to become better medical coders. We have to be willing to take constructive criticism when it is given to us. And while it is hard, it does take a lot of strength to be able to do that, to say, you know what? I was wrong on this. Let me go back, let me regroup and make myself better, so that way I can be a better coder next time down the road. We have to be able to do that. That's where we need to be focused on, okay? Now, at conference for AHIMA last year, well, in Baltimore in 2023, when they had all of that ICD-11 talk, I'm like, why are we even discussing this when this has nothing to do with us right now? It's not relevant to coders right now. If we were implementing ICD-11 tomorrow, absolutely. If we were implementing ICD-11 in 2 years, that would make sense to me. But there's no date on it yet. There's no talk about it yet. So why are we wasting time on it? Let's get focused on the things that we need to focus on. like better communication skills for coders, a stronger grasp of medical terminology and anatomy, so that way coders can understand, and getting coders to better effectively communicate, so that way they can get these providers to understand that you just can't type out whatever willy-nilly and think that it's okay and that it'll get paid. Oh, well, Blue, these claims get paid all the time. Just because they get paid doesn't mean that they're correct, guys. How many times, how many stories have we seen where these insurance companies, they pay these claims for all these years, and then they go back and they say, oops, we need to do an audit. And guess what? You're just like, whoa, what happened here? Because all this stuff was being done improperly, right? These codes are being selected improperly because this was what they thought that they should get, or that's what they thought that they were supposed to get, without actually critically thinking. This is why I tell you guys, y'all need to critically think. Y'all need to challenge yourselves to learn to do your research and not just take people's word for it. I expect people to go to this article or to do their own research, so that way they can understand on their own about these code sets and when they're implemented and why it has to go through so many hoop jumpings and things like that, and that it's not just going to be some change at breakneck speed. Oh, well, I don't know if I'm going to be able to do that because, ICD-11 is coming and we have it nowhere near on the horizon. Wasting time. That's a waste of time to worry about something that it has no bearing on the right here, right now. And while people can talk about it, that's all they're doing. They're just talking, okay? So while they're talking about it because all these other countries are in it, yes, you don't have to worry about that because that's not us right now. What you need to worry about and what's going to help you to be able to transition once we do get to that point, because we will. I don't know if it'll be in my career time, but what's going to help you to transition easier is knowing your medical terminology, your anatomy. That's going to help you to be able to transition much easier, because that was the thing that I saw with people when we were transitioning from ICD-9 to ICD-10. I saw people struggling because they did not know their anatomy and because they did not know medical terminology. I saw a lot of people struggling because of that. But once I saw them like, oh, okay, the light bulb starts to go on. And if you understand your anatomy, it's going to make understanding the code set a lot easier. So that's where y'all should be focused on. Not worried about what Sue, Jane, and Sally said, who have no experience in coding, or somebody who just selects from a sheet and calls themselves a coder. We know that's not coding. Coding is when you actually look at the documentation and you're having to critically think, and you have to abstract, or you have to verify and make sure you're auditing essentially that the codes that are being selected are correct. And if they're not, then you're going to go ahead and you're going to put the correct codes that's reflected in the documentation. That's what you do as a coder. Okay. So stop worrying, guys, about ICD-11. Again, we are nowhere near that. And again, that was one of my biggest gripes about the conference, was that they were talking about irrelevant topics like ICD-11 that has nothing to do with us right now, right, at conference. I had hoped to see other topics that were more relevant to us, like improving communication, and not just with providers, with each other, because coders have that as well, where somebody says, well, I don't want to get told that I'm wrong because I don't like that person, or I don't like that person. It doesn't matter who you like and who you don't like. That personal stuff needs to be put aside when it comes to coding. Now, it's your own personal thing, that's your own personal thing. But when it comes to the coding, the code sets, if somebody that you don't like and you see that they're right, you need to go with what they're saying. It doesn't matter how bad your ego feels. Because at the end of the day, it's not about you. And it's not about that other person. It's about the patients. That's who it's about, number one. Number two, it's about the providers, okay? And them getting paid appropriately for the services that they are providing. Again, I get excited, guys. Then it's about the facility. The facility's ability to be able to take care of that community, okay? But you have to be able to do the coding right. I'm just saying, so there's a lot on us. But with that said, I'm going to go ahead and wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share, and I'll see y'all next time. Bye.